NCLEX PN practice. Question 1. Select the member of the healthcare team that is paired with one of the main functions of this team member. Here are the options. Option A. Occupational therapist, gait exercises. Option B. Physical therapist, the provision of assistive devices to facilitate the activities of daily living. Option C. Speech and language therapist, the treatment of swallowing disorders. Option D. Case manager, ordering medications and treatments. The correct answer is option C. Speech and language therapist, the treatment of swallowing disorders. Correct answer C. Speech and language therapist, the treatment of swallowing disorders. Question 2. The recommended daily caloric intake for sedentary older men, active adult women, and children is. Here are the options. Option A. 2,400 calories. Option B. 1,600 calories. Option C. 2,800 calories. Option D. 2,000 calories. The correct answer is option D. 2,000 calories. Correct answer D. 2,000 calories. Question 3. Ill health, malnutrition, and wasting as a result of chronic disease are all associated with. Here are the options. Option A. Surgical asepsis. Option B. Catabolism. Option C. Cachexia. Option D. Venestasis. The correct answer is option C. Cachexia. Correct answer C. Cachexia. Question 4. Select all the possible opportunistic infections that adversely affect HIV/AIDS infected patients. A. Visual loss is B. Kaposi's sarcoma C. Wilms sarcoma D. Tuberculosis E. Peripheral neuropathy F. Toxoplasma gondii. Here are the options. Option A. B. Kaposi's sarcoma F. Toxoplasma gondii D. Tuberculosis. The correct answer is option A. B. Kaposi's sarcoma F. Toxoplasma gondii D. Tuberculosis. Correct answer B. Kaposi's sarcoma F. Toxoplasma gondii D. Tuberculosis. Question 5. What can help reduce a patient's anxiety and post-surgical pain? Here are the options. Option A. Preoperative teaching. Option B. Preoperative checklist. Option C. Psychological counseling. Option D. Preoperative medication. The correct answer is option A. Preoperative teaching. Correct answer A. Preoperative teaching. Question 6. Which disease decreases the metabolic rate? Here are the options. Option A. Cancer. Option B. Hypothyroidism. Option C. Chronic obstructive pulmonary disease. Option D. Cardiac failure. The correct answer is option B. Hypothyroidism. Correct answer B. Hypothyroidism. Question 7. When caring for an infant during cardiac arrest, which pulse must be palpated to determine cardiac function? Here are the options. Option A. Carotid. Option B. Brachial. Option C. Pedal. Option D, radial. The correct answer is option B, brachial. Correct answer B, brachial. Question 8. The patient should be sitting when deep breathing and coughing because this position. Here are the options. Option A is physically more comfortable for the patient. Option B helps the patient to support their incision with a pillow. Option C loosens respiratory secretions. Option D allows the patient to observe their area and relax. The correct answer is option B, helps the patient to support their incision with a pillow. Correct answer B, helps the patient to support their incision with a pillow. Question 9. Which procedures necessitate the use of surgical asepsis techniques? Select all that apply. A. Intramuscular medication administration. B. Central line intravenous medication administration. C. Donning gloves in the operating room. D. Neonatal bathing. E. Foley catheter insertion. F. Emptying a urinary drainage bag. Here are the options. Option A, B. Central line intravenous medication administration. C. Donning gloves in the operating room. E. Foley catheter insertion. The correct answer is option A, B. Central line intravenous medication administration. C. Donning gloves in the operating room. E. Foley catheter insertion. Correct answer B. Central line intravenous medication administration. C. Donning gloves in the operating room. E. Foley catheter insertion. Question 10. What is the ultimate purpose and goal of performance improvement activities? Here are the options. Option A, to increase efficiency. Option B, to contain costs. Option C, to improve processes. Option D, to improve policies. The correct answer is option C, to improve processes. Correct answer C, to improve processes. Question 11. The primary difference between practical nursing licensure and a nursing certification in an area of practice is that nursing licensure is. Here are the options. Option A ensures competency, and a nursing certification validates years of experience. Option B mandated by the American Nurses Association, and a nursing certification are not. Option C is legally mandated by the states, and a nursing certification is not. Option D renewed every 2 years, and a nursing certification is renewed every 5 years. The correct answer is option C, is legally mandated by the states, and a nursing certification is not. Correct answer C, is legally mandated by the states, and a nursing certification is not. Question 12. What intervention is the best to relieve constipation during pregnancy? Here are the options. Option A, increasing the consumption of fruits and vegetables. Option B, taking a mild over-the-counter laxative. Option C, lying flat on back when sleeping. Option D, reduction of iron intake by half or more. The correct answer is option A, increasing the consumption of fruits and vegetables. Correct answer A, increasing the consumption of fruits and vegetables. Question 13. You are the LPN working on 2 East with adult medical surgical patients. Your unit has been instructed to perform a horizontal evacuation of your patients because there is a fire on 1 East. Where will you evacuate your patients to? Here are the options. Option A, 3 West. Option B, 3 East. Option C, 2 West. Option D, 1 West. The correct answer is option C, 2 West. Correct answer C, 2 West. Question 14. Which electrolyte is essential for enzyme and neurochemical activities? Here are the options. Option A, fluoride. Option B, magnesium. Option C, potassium. Option D, phosphate. The correct answer is option B, magnesium. Correct answer B, magnesium. Question 15. Number the choices below to reflect the correct sequence for using a fire extinguisher: A. Aim at the base of the fire B. Squeeze the handle C. Sweep back and forth D. Pull the pin. Here are the options. Option A, D. Pull the pin A. Aim at the base of the fire B. Squeeze the handle C. Sweep back and forth. The correct answer is option A, D. Pull the pin A. Aim at the base of the fire B. Squeeze the handle C. Sweep back and forth. Correct answer D. Pull the pin A. Aim at the base of the fire B. Squeeze the handle C. Sweep back and forth. Question 16. As you are working, you suspect that another licensed practical nurse is verbally and physically abusing a patient. What is the first thing that you will do? Here are the options. Option A, nothing, because you are not certain that it is occurring. Option B, nothing, because you only suspect the abuse. Option C, call the police or the security department. Option D, report your suspicions to the charge nurse. The correct answer is option D. Report your suspicions to the charge nurse. Correct answer D. Report your suspicions to the charge nurse. Question 17. Which of the following is the World Health Organization's definition of health? Here are the options. Option A, the absence of all illness and disease. Option B, the absence of any comorbidities. Option C, a holistic state of well-being. Option D, a use of health promotion activities. The correct answer is option C, a holistic state of well-being. Correct answer C, a holistic state of well-being. Question 18. Which nursing theorist believes that most patients are capable of performing self-care? Here are the options. Option A, Dorothea Oram. Option B, Madeline Leininger. Option C, Martha Rogers. Option D, Sister Callister Roy. The correct answer is option A, Dorothea Oram. Correct answer A, Dorothea Oram. Question 19. What element is minimally assessed during a basic prenatal physical examination? Here are the options. Option A, palpation and auscultation of the abdomen. Option B, examination of the anus and rectum. Option C, urinalysis for glucose, protein, and ketones. Option D, visual assessment of cervix and vagina. The correct answer is option C. Urinalysis for glucose, protein, and ketones. Correct answer C. Urinalysis for glucose, protein, and ketones. Question 20. A positive over-the-counter pregnancy test is considered A. Here are the options. Option A. Possible sign of pregnancy. Option B. Presumptive sign of pregnancy. Option C. Probable sign of pregnancy. Option D. Positive sign of pregnancy. The correct answer is option C. Probable sign of pregnancy. Correct answer C. Probable sign of pregnancy. Question 21. Select all of the signs and symptoms of hyperthyroidism. A. Cool skin. B. Thickened bodily hair. C. Heat intolerance. D. Constipation. E. Insomnia. F. Increased appetite. G. Palpitations. Here are the options. Option A. C, F, G. The correct answer is option A. C, F, G. Correct answer C, F, G. Question 22. During which phase of the nursing process does data get collected and validated with the patient and or family members by the nurse? Here are the options. Option A. The implementation phase. Option B. The assessment phase. Option C. The evaluation phase. Option D. The planning phase. The correct answer is option B. The assessment phase. Correct answer B. The assessment phase. Question 23. Which of the following is the best worded expected outcome? Here are the options. Option A. The nurse will provide for adequate hydration. Option B. The nurse will ensure that the patient is safe. Option C. The patient will cough and deep breathe every 2 hours. Option D. The patient will value health. The correct answer is option C. The patient will cough and deep breathe every 2 hours. Correct answer C. The patient will cough and deep breathe every 2 hours. Question 24. What is a major difference between a problem-oriented medical record and a source-oriented medical record? Here are the options. Option A. The problem-oriented medical system has a centralized part of the chart for interdisciplinary progress notes, and the source-oriented medical record has separate areas for each profession's progress notes. Option B. The problem-oriented medical system consists of narrative progress notes, and the source-oriented medical record uses SOAP. Option C. The source-oriented medical system uses charting by exception, and the source-oriented medical record system does not. Option D. The source-oriented medical system has a centralized part of the chart for interdisciplinary progress notes, and the problem-oriented medical record has separate areas for each profession's progress notes. The correct answer is option A. The problem-oriented medical system has a centralized part of the chart for interdisciplinary progress notes, and the source-oriented medical record has separate areas for each profession's progress notes. Correct answer A. The problem-oriented medical system has a centralized part of the chart for interdisciplinary progress notes, and the source-oriented medical record has separate areas for each profession's progress notes. Question 25. Which of the following are necessary elements of malpractice? Select all that apply. A. A breach of duty. B. An intentional act. C. A non-intentional act. D. Foreseeability. E. Patient harm. F. Causation. Here are the options. Option A. A breach of duty. D. Foreseeability. E. Patient harm. F. Causation. The correct answer is option A. A breach of duty. D. Foreseeability. E. Patient harm. F. Causation. Correct answer A. A breach of duty. D. Foreseeability. E. Patient harm. F. Causation. Question 26. Select the following fire emergency interventions in correct sequential order. A. Pull the fire alarm. B. Contain the fire. C. Rescue patients in danger. D. Extinguish the fire. Here are the options. Option A. C. Rescue patients in danger. A. Pull the fire alarm. B. Contain the fire. D. Extinguish the fire. The correct answer is option A. C. Rescue patients in danger. A. Pull the fire alarm. B. Contain the fire. D. Extinguish the fire. Correct answer C. Rescue patients in danger. A. Pull the fire alarm. B. Contain the fire. D. Extinguish the fire. Question 27. After your patient has been told that they have Cushing's syndrome, the patient asks you what Cushing's syndrome is. How would you respond to this patient's question? Here are the options. Option A. Cushing's syndrome is a type of irritable bowel syndrome. Option B. Cushing's syndrome is a disorder of the adrenal gland. Option C. Cushing's syndrome often occurs among patients who are getting radiation therapy. Option D. Cushing's syndrome often occurs among patients who are chemotherapy. The correct answer is option B. Cushing's syndrome is a disorder of the adrenal gland. Correct answer B. Cushing's syndrome is a disorder of the adrenal gland. Question 28. You are preparing a sterile field for an operating room surgical procedure. When should you stop the preparation of this sterile field? Here are the options. Option A. When you have placed a sterile item only 1 inch and not 2 inches from the edge of the sterile field. Option B. When you have completely finished the field. You cannot stop the setup until it is all done. Option C. When you have accidentally poured a sterile liquid into a container that was on the sterile field. Option D. When you turn your upper body only away from the field because the surgeon calls your name. The correct answer is option D. When you turn your upper body only away from the field because the surgeon calls your name. Correct answer D. When you turn your upper body only away from the field because the surgeon calls your name. Question 29. Evel's teeth should be placed in. Here are the options. Option A. Normal saline. Option B. Cold water. Option C. Milk. Option D. Warm water. The correct answer is option C. Milk. Correct answer C. Milk. Question 30. You are working in a pediatric unit of the hospital and caring for a 6-year-old boy who is hospitalized with cystic fibrosis and respiratory compromise. Which developmental task is the challenge for this boy at his age? Here are the options. Option A. To cough, deep breathe, and improve respiratory status. Option B. To establish industry and self-confidence. Option C. To develop autonomy and self-control. Option D. To develop initiative and a sense of purpose. The correct answer is option D. To develop initiative and a sense of purpose. Correct answer D. To develop initiative and a sense of purpose. Question 31. The embryonic period during pregnancy takes place from. Here are the options. Option A. Weeks 1 to 12. Option B. Weeks 1 to 10. Option C. Weeks 3 to 5. Option D. Weeks 6 to 10. The correct answer is option D. Weeks 6 to 10. Correct answer D. Weeks 6 to 10. Question 32. Place these human needs in order from the greatest priority to the least priority using #1 as the greatest priority and #5 as the least of all in terms of priority. A. Self-esteem and esteem by others. B. Self-actualization. C. Psychological needs. D. Love and belonging. E. Physiological needs. Here are the options. Option A. E. Physiological needs. C. Psychological needs. D. Love and belonging. A. Self-esteem and esteem by others. B. Self-actualization. The correct answer is option A. E. Physiological needs. C. Psychological needs. D. Love and belonging. A. Self-esteem and esteem by others. B. Self-actualization. Correct answer E. Physiological needs. C. Psychological needs. D. Love and belonging. A. Self-esteem and esteem by others. B. Self-actualization. Question 33. During which week does the fetal heart begin pumping its own blood? Here are the options. Option A. 3rd week. Option B. 5th week. Option C. 9th week. Option D. 6th week. The correct answer is option A. 3rd week. Correct answer A. 3rd week. Question 34. Which of the following is a vector of infection? Here are the options. Option A. A contaminated ball. Option B. A contaminated thermometer. Option C. An infected person. Option D. An infectious fly. The correct answer is option D. An infectious fly. Correct answer D. An infectious fly. Question 35. Which oral disorder appears as yellow or white spots on the oral mucosa that are not possible to scrape off without bleeding? Here are the options. Option A. Herpes simplex. Option B. Candidiasis. Option C. Aphthous ulcers. Option D. Leukoplakia. The correct answer is option B. Candidiasis. Correct answer B. Candidiasis. Question 36. Which type of cancer has the poorest prognosis? Here are the options. Option A. Squamous cell carcinoma. Option B. Breast cancer. Option C. Pancreatic cancer. Option D. Gastric cancer. The correct answer is option C. Pancreatic cancer. Correct answer C. Pancreatic cancer. Question 37. States throughout our nation vary somewhat in terms of things that nursing assistants can and cannot legally do. Which statements about these state-to-state differences are accurate? Select all that apply. A. Nursing assistants can change catheter tubings, but not catheters. B. Nursing assistants can change sterile dressings. C. Nursing assistants have an expanding role in many states. D. Nursing assistants cannot assess the physical status of the patients. E. Nursing assistants can apply topical medication lotions to intact skin. F. The trend is moving toward nurses-only staffing patterns. Here are the options. Option A. C. Nursing assistants have an expanding role in many states. D. Nursing assistants cannot assess the physical status of the patients. The correct answer is option A. C. Nursing assistants have an expanding role in many states. D. Nursing assistants cannot assess the physical status of the patients. Correct answer C. Nursing assistants have an expanding role in many states. D. Nursing assistants cannot assess the physical status of the patients. Question 38. A cesarean mode of delivery, often utilized for various reasons, is the most common mode for females with which pelvic type? Here are the options. Option A. Android. Option B. Anthropoid. Option C. Gynecoid. Option D. Platyploid. The correct answer is option A. Android. Correct answer A. Android. Question 39. How many bones make up a newborn's skull? Here are the options. Option A. 8. Option B. 4. Option C. 6. Option D. 5. The correct answer is option D. 5. Correct answer D. 5. Question 40. Your patient has just returned from the diagnostic imaging department and the doctor has told the patient that they have a Mallory-Weiss tear. The patient asks you what a Mallory-Weiss tear is. How should you respond to this patient? Here are the options. Option A. A Mallory-Weiss tear is a kind of diverticulitis. Option B. A Mallory-Weiss tear is an esophageal tear. Option C. A Mallory-Weiss tear is a lacrimal gland disorder. Option D. A Mallory-Weiss tear is a tear that results from a peptic ulcer. The correct answer is option B. A Mallory-Weiss tear is an esophageal tear. Correct answer B. A Mallory-Weiss tear is an esophageal tear. Question 41. You have been asked to speak at a new nursing assistance orientation class about infection control and hand-washing techniques. What would you include in this teaching? Here are the options. Option A. Demonstrate the correct 1-minute hand-washing procedure using soap and running water. Option B. Demonstrate the correct 2-minute hand-washing procedure using soap and running water. Option C. Using hot water so that the natural fats on the skins are emulsified with the soap. Option D. Using cold water so that the natural fats on the skins are emulsified with the soap. The correct answer is option B. Demonstrate the correct 2-minute hand-washing procedure using soap and running water. Correct answer B. Demonstrate the correct 2-minute hand-washing procedure using soap and running water. Question 42. How many minims are contained in 1 milliliter? Here are the options. Option A. Between 10-11. Option B. 12. Option C, 20. Option D, between 15 or 16. The correct answer is option D, between 15 or 16. Correct answer D, between 15 or 16. Question 43. Periwound maceration occurs when? Here are the options. Option A, the skin around the wound softens and is damaged. Option B, selecting a dressing individualized to the type of wound. Option C, negative pressure to air out the wound is used. Option D, the skin around the wound dries out and hardens. The correct answer is option A. The skin around the wound softens and is damaged. Correct answer A. The skin around the wound softens and is damaged. Question 44. Which patient is at greatest risk for cholelithiasis and cholecystectomies? Here are the options. Option A, a 70-year-old male patient who has liver disease. Option B, a 70-year-old female patient who has liver disease. Option C, a 50-year-old male patient who is Asian. Option D, a 50-year-old female patient who is Asian. The correct answer is option B, a 70-year-old female patient who has liver disease. Correct answer B, a 70-year-old female patient who has liver disease. Question 45. Select the method of special precautions that is accurately paired with the personal protective equipment that is minimally required in order to prevent the spread of infection. Here are the options. Option A, contact precautions, gowns, gloves, and mask. Option B, droplet precautions, face mask. Option C, airborne transmission precautions, negative pressure room. Option D, contact precautions, gloves. The correct answer is option B, droplet precautions, face masks. Correct answer B, droplet precautions, face mask. Question 46. Which statement about Meniere's disease is accurate and true? Here are the options. Option A, Meniere's disease most commonly occurs among members of the elderly population. Option B, Meniere's disease is insidious and it always affects both ears. Option C, Meniere's disease occurs with an impairment of the second cranial nerve. Option D, antiemetic drugs are used for the treatment of patients affected with Meniere's disease. The correct answer is option D. Antiemetic drugs are used for the treatment of patients affected with Meniere's disease. Correct answer D. Antiemetic drugs are used for the treatment of patients affected with Meniere's disease. Question 47. Which of these patients is affected with a healthcare-acquired infection? Here are the options. Option A, a 18-year-old male patient who developed an intravenous line infection 2 days after insertion. Option B, a 72-year-old male patient who is at risk for infection secondary to AIDS/HIV. Option C, a 67-year-old female patient who was admitted with a urinary tract infection. Option D, a 5-year-old pediatric patient who develops the measles rash 3 days after admission. The correct answer is option A, a 18-year-old male patient who developed an intravenous line infection 2 days after insertion. Correct answer A, a 18-year-old male patient who developed an intravenous line infection 2 days after insertion. Question 48. The stages of infection in correct sequential order are, here are the options. Option A. The prodromal, incubation, illness and convalescence stages. Option B. The incubation, prodromal, illness and convalescence stages. Option C. The prodromal, primary, secondary and tertiary stages. Option D. The inflammation, infection and immunity stages. The correct answer is option A. The prodromal, incubation, illness and convalescence stages. Correct answer A. The prodromal, incubation, illness and convalescence stages. Question 49. What is the single most important thing that nurses do in order to prevent the spread of infection? Here are the options. Option A. Applying standard precautions. Option B. Using personal protective equipment. Option C. Adhering to the principles of asepsis. Option D. Hand washing. The correct answer is option D. Hand washing. Correct answer D. Hand washing. Question 50. Rh-negative maternal blood indicates. Here are the options. Option A. An incompatibility in the blood between the mother and fetus. Option B. That antibodies in the mother's blood are attacking her baby's blood. Option C. The mother will require a blood transfusion at the time of delivery. Option D. The mother does not have a specific marker on her red blood cells. The correct answer is option D. The mother does not have a specific marker on her red blood cells. Correct answer D. The mother does not have a specific marker on her red blood cells. Question 51. Low birth weight is defined as a newborn's weight of. Here are the options. Option A. 2,500 grams or less at birth, regardless of gestational age. Option B. 1,500 grams or less at birth, regardless of gestational age. Option C. 2,500 grams or less at birth, according to gestational age. Option D. 1,500 grams or less at birth, according to gestational age. The correct answer is option A. 2,500 grams or less at birth, regardless of gestational age. Correct answer A. 2,500 grams or less at birth, regardless of gestational age. Question 52. You are caring for a neonate who has a cleft palate. You should inform the mother that surgical correction will be done when the infant is. Here are the options. Option A. 8 to 12 months of age. Option B. 20 to 24 months of age. Option C. 16 to 20 months of age. Option D. 12 to 16 months of age. The correct answer is option A. 8 to 12 months of age. Correct answer A. 8 to 12 months of age. Question 53. What percentage of term newborns has a congenital heart disease due to environmental risk factors such as maternal alcoholism or drug ingestion? Here are the options. Option A. 2% to 4%. Option B. 10% to 20%. Option C. 5% to 10%. Option D. 7% to 9%. The correct answer is option C. 5% to 10%. Correct answer C. 5% to 10%. Question 54. Who should document care? Here are the options. Option A. The LPN should document the care that they provided and the care that was given by unlicensed assistive staff. Option B. The registered nurse must document all of the care that is provided by the nursing assistants because they are accountable for all care. Option C. All staff members should document all of the care that they have provided. Option D. All staff should document all of the care that they have provided, but the registered nurse, as the only independent practitioner, signs it. The correct answer is option C. All staff members should document all of the care that they have provided. Correct answer C. All staff members should document all of the care that they have provided. Question 55. Your 54-year-old male HIV-positive patient has just expired. How should you care for this decreased patient? Here are the options. Option A. Bathe the patient, but it is no longer necessary to use standard precautions because the patient is decreased. Option B. Place the patient in a negative pressure isolated area of the morgue. Option C. Double shroud the patient to prevent the spread of infection. Option D. Bathe the patient using the same standard precautions you used when he was alive. The correct answer is option D. Bathe the patient using the same standard precautions you used when he was alive. Correct answer D. Bathe the patient using the same standard precautions you used when he was alive. Question 56. Select the types of pain that are accurately coupled with an example of it. Select all that are correct. A. Radicular pain, a broken bone. B. Central neuropathic pain, a spinal cord injury. C. Peripheral neuropathic pain, a fractured leg bone. D. Chronic pain, a stab wound to the chest. E. Nociceptive pain, a laceration. F. Radicular pain, a herniated spinal disc. Here are the options. Option A. B. Central neuropathic pain, a spinal cord injury. E. Nociceptive pain, a laceration. F. Radicular pain, a herniated spinal disc. The correct answer is option A. B. Central neuropathic pain, a spinal cord injury. E. Nociceptive pain, a laceration. F. Radicular pain, a herniated spinal disc. Correct answer B. Central neuropathic pain, a spinal cord injury. E. Nociceptive pain, a laceration. F. Radicular pain, a herniated spinal disc. Question 57. Select the stage of viral hepatitis that is accurately paired with its characteristic S. Here are the options. Option A. The prodromal stage. Jaundice begins. Option B. The icteric stage. Flu-like symptoms occur. Option C. The praecteric stage. Elevated urine bilirubin levels. Option D. The posticteric stage. Jaundice and dark urine occurs. The correct answer is option C. The praecteric stage. Elevated urine bilirubin levels. Correct answer C. The praecteric stage. Elevated urine bilirubin levels. Question 58. Which nursing diagnosis is the most commonly used among patients who are affected with fibromyalgia? Here are the options. Option A. Decreased self-care in the activities of daily living related to fatigue. Option B. Impaired mental functioning related to electrolyte imbalances. Option C. Increased vigilance secondary to electrolyte imbalances. Option D. At risk for a swallowing disorder related to fibromyalgia. The correct answer is option A. Decreased self-care in the activities of daily living related to fatigue. Correct answer, A. Decreased self-care in the activities of daily living related to fatigue. Question 59. Alcohol, caffeine, or drugs are high risk factors that all fall under which broad classification of risk factors? Here are the options. Option A. Social demographic. Option B. Environmental. Option C. Biophysical. Option D. Psychosocial. The correct answer is option D. Psychosocial. Correct answer D. Psychosocial. Question 60. Multifetal pregnancies with triplets occur at a rate of 1 in 8,100 births, but twins occur much more frequently with a rate of. Here are the options. Option A. 1 in 85 births. Option B. 1 in 5,400 births. Option C. 1 in 2,700 births. Option D. 1 in 540 births. The correct answer is option A. 1 in 85 births. Correct answer, A. 1 in 85 births. Question 61. When a woman has miscarried in 3 or more consecutive pregnancies, it is referred to as which type of spontaneous abortion? Here are the options. Option A. Inevitable. Option B. Missed. Option C. Habitual. Option D. Septic. The correct answer is option C. Habitual. Correct answer C. Habitual. Question 62. Your long-term care patient has chronic pain, and at this point in time the patient needs increasing dosages to adequately control this pain. What is this patient most likely to be affected with? Here are the options. Option A. Drug addiction. Option B. Drug interactions. Option C. Drug side effects. Option D. Drug tolerance. The correct answer is option D. Drug tolerance. Correct answer D. Drug tolerance. Question 63. The normal sodium level in the body is. Here are the options. Option A. 135 to 145 milliequivalents. Option B. 3 to 5 milliequivalents. Option C. 135 to 145 microequivalents. Option D. 3 to 5 microequivalents. The correct answer is option A. 135 to 145 milliequivalents. Correct answer A. 135 to 145 milliequivalents. Question 64. Which type of practice is most similar to research-based practice? Here are the options. Option A. Best practices. Option B. Evidence-based practice. Option C. Benchmark practices. Option D. Standard-based practice. The correct answer is option B. Evidence-based practice. Correct answer B. Evidence-based practice. Question 65. Select the ethical principles that are paired with their description. Select all that apply. A. Justice, being honest and fair. B. Fidelity, being faithful. C. Veracity, truthfulness. D. Autonomy, facilitating patient choices. E. Beneficence, do good. F. non-maleficence, do not harm. Here are the options. Option A, B. Fidelity, being faithful, C. Veracity, truthfulness, D. Autonomy, facilitating patient choices, E. Beneficence, do good, F. Non-maleficence, do not harm. The correct answer is option A. B. Fidelity, being faithful, C. Veracity, truthfulness, D. Autonomy, facilitating patient choices, E. Beneficence, do good, F. Non-maleficence, do not harm. Correct answer, B. Fidelity, being faithful, C. Veracity, truthfulness, D. Autonomy, facilitating patient choices, E. Beneficence, do good, F. Non-maleficence, do not harm. Question 66. You are caring for a patient with multiple trauma. Of all of these injuries and conditions, is it the most serious? Here are the options. Option A, a deviated trachea. Option B, gross deformity of a lower extremity. Option C, hematuria. Option D, decreased bowel sounds. The correct answer is option A, a deviated trachea. Correct answer, A. A deviated trachea. Question 67. Which statement about appendicitis is accurate and true? Here are the options. Option A, appendicitis is more common among females than males. Option B, a high-fiber diet is a risk factor associated with appendicitis. Option C, left lower quadrant pain is suggestive of appendicitis. Option D, McBurney's point tenderness is suggestive of appendicitis. The correct answer is option D. McBurney's point tenderness is suggestive of appendicitis. Correct answer D. McBurney's point tenderness is suggestive of appendicitis. Question 68. Which skin disorder most closely resembles and mimics dandruff? Here are the options. Option A, lice infestation. Option B, scabies. Option C, dermatitis. Option D, acne vulgaris. The correct answer is option A, lice infestation. Correct answer, A. Lice infestation. Question 69. You have just learned that another nurse was fired for taking photographs of patients without their permission using a cell phone and posting them on Facebook. This nurse was fired because the nurse has, here are the options. Option A, violated the law. Option B, acted in a negligent manner. Option C, not completed the proper documentation. Option D, violated an ethical principle. The correct answer is option A, violated the law. Correct answer, A. Violated the law. Question 70. Which of the following differentiates ulcerative colitis from Crohn's disease? Here are the options. Option A, Crohn's disease primarily affects the left colon and rectum, and ulcerative colitis most often affects the right colon and distal ileum. Option B, Crohn's disease presents with shallow ulcerations and ulcerative colitis presents with a cobblestone appearance of the mucosal lining. Option C, the extent of involvement is non-contiguous and segmented with Crohn's disease, and it is contiguous and diffuse with ulcerative colitis. Option D, Crohn's disease has primarily mucosal involvement and it is transmural with ulcerative colitis. The correct answer is option D. Crohn's disease has primarily mucosal involvement and it is transmural with ulcerative colitis. Correct answer D. Crohn's disease has primarily mucosal involvement and it is transmural with ulcerative colitis. Question 71. Which atrioventricular heart block is also referred to as Mabitz Roman 2? Here are the options. Option A. Third-degree atrioventricular heart block. Option B. Second-degree atrioventricular heart block. Option C. First-degree atrioventricular heart block. Option D. Complete heart block. The correct answer is option A. Third-degree atrioventricular heart block. Correct answer A. Third-degree atrioventricular heart block. Question 72. Which preventive measure can be employed to decrease the risk of compartment syndrome? Here are the options. Option A. The administration of a potassium-sparing diuretic for heart failure. Option B. A bivalve cast for a skeletal fracture. Option C. A cerebral diuretic to decrease intracranial pressure after a head injury. Option D. A chest tube to restore normal introthoracic pressure after a pneumothorax. The correct answer is option B. A bivalve cast for a skeletal fracture. Correct answer B. A bivalve cast for a skeletal fracture. Question 73. Which patient is at greatest risk for papilledema? Here are the options. Option A. An elderly patient with cataracts and macular degeneration. Option B. A male patient with hypothyroidism. Option C. A male patient with hyperthyroidism. Option D. An adolescent with a closed head injury. The correct answer is option D. An adolescent with a closed head injury. Correct answer D. An adolescent with a closed head injury. Question 74. Your patient has been diagnosed with orchitis. What information about this disorder should you inform the patient about? Here are the options. Option A. This disorder often occurs as the result of a streptococcus. Option B. This disorder can be symptomatically treated with ice. Option C. This disorder can be symptomatically treated with heat. Option D. This disorder is typically treated with surgery. The correct answer is option B. This disorder can be symptomatically treated with ice. Correct answer B. This disorder can be symptomatically treated with ice. Question 75. Which of the following healthcare providers can legally have access to all or part of a patient's medical record because they have a need to know? Select all that apply. A. Student nurses caring for a particular patient. B. Registered nurses when they are not caring for a particular patient. C. The vice president for nursing who is investigating a patient fall. D. Licensed practical nurses caring for a particular patient. E. A quality assurance nurse collecting data for performance improvement activity. Here are the options. Option A. A. Student nurses caring for a particular patient. C. The vice president for nursing who is investigating a patient fall. D. Licensed practical nurses caring for a particular patient. E. A quality assurance nurse collecting data for a performance improvement activity. The correct answer is option A. A. Student nurses caring for a particular patient. C. The vice president for nursing who is investigating a patient fall. D. Licensed practical nurses caring for a particular patient. E. A quality assurance nurse collecting data for a performance improvement activity. Correct answer: A. Student nurses caring for a particular patient. C. The vice president for nursing who is investigating a patient fall. D. Licensed practical nurses caring for a particular patient. E. A quality assurance nurse collecting data for a performance improvement activity. Question 76. Which cardiac arrhythmia can be either acquired or congenital and can spontaneously disappear on its own or lead to ventricular fibrillation? Here are the options. Option A. Wenckebach. Option B. Premature arterial contractions. Option C. Torsades de Pointes. Option D. Premature ventricular contractions. The correct answer is option C. Torsades de Pointes. Correct answer C. Torsades de Pointes. Question 77. Which quality assurance or performance improvement technique is used to identify underlying process flaws? Here are the options. Option A. Small group process. Option B. Root cause analysis. Option C. People at fault process. Option D. Cause and effect. The correct answer is option B. Root cause analysis. Correct answer B. Root cause analysis. Question 78. Which legal document will most likely contain the patient's decision to not get cardiopulmonary resuscitation? Here are the options. Option A. Healthcare surrogacy. Option B. Healthcare proxy. Option C. Advance directives. Option D. Durable power of attorney. The correct answer is option C. Advance directives. Correct answer C. Advance directives. Question 79. Select the stage of a pressure ulcer that is accurately paired with its characteristics. Here are the options. Option A. Stage I. Only slight blanching when pressure is applied to the skin. Option B. Stage II. The epidermis and part of the dermis is damaged or lost. Option C. Stage III. The wound has slough and eschar. Option D. Stage IV. The loss of skin usually exposes some fat. The correct answer is option B. Stage II. The epidermis and part of the dermis is damaged or lost. Correct answer B. Stage II. The epidermis and part of the dermis is damaged or lost. Question 80. You have been assigned to care for a neonate who has been diagnosed with the tetralogy of Fallot. The mother asks you what the tetralogy of Fallot is. How should you respond to this mother? Here are the options. Option A. The tetralogy of Fallot is a congenital gastrointestinal disorder. Option B. The tetralogy of Fallot is a congenital cardiac disorder. Option C. The tetralogy of Fallot will affect the baby's reflexes. Option D. The tetralogy of Fallot will affect the baby's ability to breastfeed. The correct answer is option B. The tetralogy of Fallot is a congenital cardiac disorder. Correct answer B. The tetralogy of Fallot is a congenital cardiac disorder. Question 81. The protrusion of an internal organ through a wound or surgical incision is referred to as. Here are the options. Option A. Serisanguineus. Option B, dehiscence. Option C, evisceration. Option D, exuded. The correct answer is option C, evisceration. Correct answer C, evisceration. Question 82. Which pain assessment scale is used exclusively for infants and neonates from 32 weeks of gestation to 6 months of age? Here are the options. Option A, the PEPS pain scale. Option B, the FLAC pain scale. Option C, the FACES pain scale. Option D, the CRIES pain scale. The correct answer is option D, the CRIES pain scale. Correct answer D, the CRIES pain scale. Question 83. Which of the following is a hazard of immobility? Here are the options. Option A, loss of bone calcium. Option B, increased vital capacity. Option C, venous vasoconstriction. Option D, a positive nitrogen balance. The correct answer is option A, loss of bone calcium. Correct answer A, loss of bone calcium. Question 84. How many daily feedings are considered normal for a newborn? Here are the options. Option A, 8 to 10. Option B, 10 to 12. Option C, 6 to 8. Option D, 12 to 14. The correct answer is option B, 10 to 12. Correct answer B, 10 to 12. Question 85. The hormone produces mother's milk is. Here are the options. Option A, progesterone. Option B, estrogen. Option C, prolactin. Option D, colostrum. The correct answer is option C, prolactin. Correct answer C, prolactin. Question 86. Which of the following is a life-threatening acute complication of diabetes mellitus? Here are the options. Option A, neuropathy. Option B, hypoglycemia. Option C, retinopathy. Option D, impaired microcirculation. The correct answer is option B, hypoglycemia. Correct answer B, hypoglycemia. Question 87. Sutures and staples are typically removed following surgery within. Here are the options. Option A, 7 to 10 days if healing is considered adequate. Option B, 10 to 14 days if healing is considered adequate. Option C, 7 to 10 days if no further dressings are needed. Option D, 10 to 14 days if no further dressings are needed. The correct answer is option A, 7 to 10 days if healing is considered adequate. Correct answer A, 7 to 10 days if healing is considered adequate. Question 88. Which of these breath sounds is considered normal and not adventitious? Here are the options. Option A, vesicular breath sounds. Option B, fine rales. Option C, rhonchi. Option D, wheezes. The correct answer is option A, vesicular breath sounds. Correct answer A, vesicular breath sounds. Question 89. Which type of burn leads to the greatest degree of pain? Here are the options. Option A, a first-degree burn. Option B, a second-degree burn. Option C, a third-degree burn. Option D, a fourth-degree burn. The correct answer is option B, a second-degree burn. Correct answer B, a second-degree burn. Question 90. Babies should double their birth weight by the. Here are the options. Option A, 5th to 6th month. Option B, 3rd to 4th month. Option C, 4th to 5th month. Option D, 5th to 7th month. The correct answer is option C, 4th to 5th month. Correct answer C, 4th to 5th month. Question 91. Which of the following is best for a client who has difficulty swallowing and chokes frequently? Here are the options. Option A, a liquid diet. Option B, tilting the head back when swallowing. Option C, tucking the chin in when swallowing. Option D, following each bite with a drink of water. The correct answer is option C, tucking the chin in when swallowing. Correct answer C, tucking the chin in when swallowing. Question 92. How long can women lactate for? Here are the options. Option A, indefinitely. Option B, 12 to 18 months. Option C, 18 to 24 months. Option D, 30 to 36 months. The correct answer is option A, indefinitely. Correct answer A, indefinitely. Question 93. Which anatomic malformations are associated with the tetralogy of Fallot? Here are the options. Option A, a subaortic septal defect, an overriding aorta, left ventricular hypertrophy, and right ventricular outflow. Option B, a subaortic septal defect, an overriding aorta, right ventricular hypertrophy, and left ventricular outflow. Option C, a subaortic septal defect, an overriding aorta, pulmonary atresia, and right ventricular outflow. Option D, a subaortic septal defect, an overriding aorta, right ventricular hypertrophy, and right ventricular outflow. The correct answer is option D, a subaortic septal defect, an overriding aorta, right ventricular hypertrophy, and right ventricular outflow. Correct answer D, a subaortic septal defect, an overriding aorta, right ventricular hypertrophy, and right ventricular outflow. Question 94. Your 32-year-old female patient has erythema marginatum, sydenham chorea, epistaxis, abdominal pain, fever, cardiac problems, and skin nodules. What disorder would you most likely suspect based on these signs and symptoms? Here are the options. Option A, leukemia. Option B, histoplasmosis. Option C, pneumocystis jirovec. Option D, rheumatoid arthritis. The correct answer is option D, rheumatoid arthritis. Correct answer D, rheumatoid arthritis. Question 95. Select the cranial nerve that is accurately paired with its name. Here are the options. Option A, the first cranial nerve, the trochlear nerve. Option B, the 12th cranial nerve, the hypoglossal nerve. Option C. The 10th cranial nerve, the olfactory nerve. Option D. The 13th cranial nerve, the auditory nerve. The correct answer is option B. The 12th cranial nerve, the hypoglossal nerve. Correct answer B. The 12th cranial nerve, the hypoglossal nerve. Question 96. What is the name of the section marked? Here are the options. Option A. Left ventricle. Option B. Right ventricle. Option C. Left atrium. Option D. Right atrium. Option E. Coronary artery. Option F. Pulmonary artery. The correct answer is option F. Pulmonary artery. Correct answer F. Pulmonary artery. Question 97. Round off these numbers to the nearest hundredth. Fill in the blanks. A. 5.5778 equals blank B. 1.027 equals blank C. 62.999 equals blank D. 55.123 equals blank E. 96.679 equals blank. Here are the options. Option A. 5.58. B. 1.03. C. 63. D. 55.12. E. 96.68. The correct answer is option A. 5.58. B. 1.03. C. 63. D. 55.12. E. 96.68. Correct answer. A. 5.58. B. 1.03. C. 63. D. 55.12. E. 96.68. Question 98. Label the following bones of the pelvis. Here are the options. Option A. Pelvis. B. Sacrum. C. Coccyx. D. Symphysis pubis. The correct answer is option A. Pelvis. B. Sacrum. C. Coccyx. D. Symphysis pubis. Correct answer. A. Pelvis. B. Sacrum. C. Coccyx. D. Symphysis pubis. Question 99. Round off these numbers to the nearest 10th colon. A. 5.5778 equals blank B. 1.027 equals blank C. 62.999 equals blank D. 55.123 equals blank E. 96.676 equals blank. Here are the options. Option A. 5.6. B. 1. C. 63. D. 55.1. E. 96.7. The correct answer is option A. 5.6. B. 1. C. 63. D. 55.1. E. 96.7. Correct answer. A. 5.6. B. 1. C. 63. D. 55.1. E. 96.7. Question 100. The doctor has ordered 500 mg of a medication PO once a day. The tablets on hand are labeled as 1 tablet equals 250 mg. How many tablets will you administer to your patient? Here are the options. Option A. 1 tablet. Option B. 2 tablets. Option C, 3 tablets. Option D, 4 tablets. The correct answer is option B, 2 tablets. Correct answer B, 2 tablets. Question 101. Which patient is exercising their right to autonomy in the context of patient rights? Here are the options. Option A, an 86-year-old female who remains independent in terms of the activities of daily living. Option B, an unemancipated 16-year-old who chooses to not have an intravenous line. Option C, a 32-year-old who does not need the help of the nurse to bathe and groom themselves. Option D, a 99-year-old who wants CPR despite the fact that the nurse and doctor do not think that it would be successful. The correct answer is option D, a 99-year-old who wants CPR despite the fact that the nurse and doctor do not think that it would be successful. Correct answer D, a 99-year-old who wants CPR despite the fact that the nurse and doctor do not think that it would be successful. Question 102. The mnemonic PERLA is useful for the assessment of the eyes. What does PERLA stand for? Here are the options. Option A, pupils equally reactive to light and accommodation. Option B, patient eyes are equally recessed and responsive to light and acuity. Option C, patient eyes are equally responsive to light and acuity. Option D, pupils equally reactive to light and acuity. The correct answer is option A, pupils equally reactive to light and accommodation. Correct answer A, pupils equally reactive to light and accommodation. Question 103. You are performing a neurological assessment of your adolescent patient. The patient has the Moro reflex. How should you interpret this neurological assessment finding? Here are the options. Option A, it is normal among adolescents. Option B, it indicates that the patient has an intact peripheral nervous system. Option C, it indicates that the patient has an intact central nervous system. Option D, it is not a normal finding. The correct answer is option D, it is not a normal finding. Correct answer D, it is not a normal finding. Question 104. Which patient is most at risk for Osgood-Schlatter disease? Here are the options. Option A, an elderly female who is hospitalized with a hip fracture and on bed rest. Option B, a middle-aged male patient who has been exposed to asbestos in the shipping industry. Option C, an adolescent who is physically active and the captain of their soccer team. Option D, an infant of low birth weight and a gestational age of 28 weeks. The correct answer is option C, an adolescent who is physically active and the captain of their soccer team. Correct answer C, an adolescent who is physically active and the captain of their soccer team. Question 105. Your client is adversely affected with fever, night sweats, occult hematuria, tenderness of the spleen, and Osler's nodes. What disorder would you most likely suspect? Here are the options. Option A, tuberculosis. Option B, AIDS/HIV. Option C, pericarditis. Option D, endocarditis. The correct answer is option D, endocarditis. Correct answer D, endocarditis. Question 106. Your pediatric weighs 15.8 kg. How many pounds does this child weigh? Here are the options. Option A, 36 pounds. Option B, 33.6 pounds. Option C, 35 pounds. Option D, 34.8 pounds. The correct answer is option D, 34.8 pounds. Correct answer, D, 34.8 pounds. Question 107. An episiotomy is, here are the options. Option A, a surgical incision of the perineum to prevent tearing during delivery. Option B, releasing the red plug from the cervix just before crowning occurs. Option C, an incision in the abdomen with which the baby can be delivered through. Option D, the severance of the umbilical cord between mother and child. The correct answer is option A, a surgical incision of the perineum to prevent tearing during delivery. Correct answer, A, a surgical incision of the perineum to prevent tearing during delivery. Question 108. How many calories per kilogram does an average full-term infant require when the infant is around 1-2 months old? Here are the options. Option A, 140 calories per kilogram per day. Option B, 120 calories per kilogram per day. Option C, 100 calories per kilogram per day. Option D, 160 calories per kilogram per day. The correct answer is option B, 120 calories per kilogram per day. Correct answer, B, 120 calories per kilogram per day. Question 109. What are the 6 levels of consciousness from the most to the least responsive level of consciousness? Number all 6 using 1 as the most conscious and 6 as the least conscious. A. Obtunded B. Confused C. Lethargic D. Comatose C. Stuporous F. Alert. Here are the options. Option A, A4, B2, C3, D6, E5, F1. The correct answer is option A, A4, B2, C3, D6, E5, F1. Correct answer, A4, B2, C3, D6, E5, F1. Question 110. Select the stage of shock that is accurately paired with its characteristic. Here are the options. Option A. The initial stage of shock, hyperventilation occurs and the blood pH rises. Option B. The compensatory stage of shock, hypoxia occurs and lactic acid rises. Option C. The progressive stage of shock, histamine is released, fluid and proteins leak into surrounding tissues and the blood thickens. Option D. The refractory stage of shock, potassium ions leak out, sodium ions build up and metabolic acidosis increases. The correct answer is option C. The progressive stage of shock, histamine is released, fluid and proteins leak into surrounding tissues and the blood thickens. Correct answer C. The progressive stage of shock, histamine is released, fluid and proteins leak into surrounding tissues and the blood thickens. Question 111. The doctor has ordered 1000 cc of intravenous fluid every 8 hours. You will be using intravenous tubing that delivers 20 cc/drop. At what rate will you adjust the intravenous fluid flow? Blank GTTS per minute. Here are the options. Option A, B. The correct answer is option A, B. Correct answer, B. Question 112. During which stage of anesthesia is a patient most likely to experience involuntary motor activity? Here are the options. Option A, stage I. Option B, stage Roman II. Option C, stage Roman III. Option D, stage VI. The correct answer is option B, stage Roman II. Correct answer, B. Stage Roman II. Question 113. Select all of the risk factors that are associated with deep vein thrombosis. A. The use of oral contraceptives. B. Type B and O blood. C. Rh negative blood. D. Obesity. E. Nulliparity. F. Leukemia. Here are the options. Option A, A. The use of oral contraceptives. D. Obesity. The correct answer is option A, A. The use of oral contraceptives. D. Obesity. Correct answer, A. The use of oral contraceptives. D. Obesity. Question 114. Most water leaves the body by way of the. Here are the options. Option A, lungs. Option B, intestines. Option C, skin. Option D, kidneys. The correct answer is option D, kidneys. Correct answer, D. Kidneys. Question 115. Which statement about glaucoma is true and accurate? Here are the options. Option A. Acute angle closure glaucoma is an ocular emergency. Option B. Acute angle closure glaucoma leads to the loss of peripheral vision and tunnel vision. Option C. Primary open-angle glaucoma leads to eye pain, nausea and vomiting, blurry vision, and halos. Option D. Bubbles are implanted to protect the retina from the glaucoma. The correct answer is option A. Acute angle closure glaucoma is an ocular emergency. Correct answer, A. Acute angle closure glaucoma is an ocular emergency. Question 116. A cavity containing pus surrounded by inflamed tissue is. Here are the options. Option A, cellulitis. Option B, an abscess. Option C, extravasation. Option D, an adhesion. The correct answer is option B, an abscess. Correct answer, B, an abscess. Question 117. The doctor has ordered 20 cc an hour of normal saline intravenously for your pediatric patient. You will be using a pediatric intravenous tubing that delivers 60 cc per drop. How many drops per minute will you administer using this pediatric intravenous set? Fill in the blank drops per minute. Here are the options. Option A, 30 drops per minute. Option B, 25 drops per minute. Option C, 20 drops per minute. Option D, 22 drops per minute. The correct answer is option C, 20 drops per minute. Correct answer, C, 20 drops per minute. Question 118. What does the mnemonic device ABCTEST stand for? Here are the options. Option A: allergy, bleeding, chemicals, dietary, environment. Option B: allergy, bleeding, cardio, diabetes, endocrine. Option C: allergy, bleeding, cardio, digestive, endocrine. Option D: allergy, bleeding, cortisone, diabetes, emboli. The correct answer is option D: allergy, bleeding, cortisone, diabetes, emboli. Correct answer D: allergy, bleeding, cortisone, diabetes, emboli. Question 119. Which of the following assessment tools is used to determine the patient's level of consciousness? Here are the options. Option A: the Snellen scale. Option B: the Norton scale. Option C: the Morse scale. Option D: the Glasgow scale. The correct answer is option D: the Glasgow scale. Correct answer D: the Glasgow scale. Question 120. Wilms tumor is a form of. Here are the options. Option A: renal cancer. Option B: liver cancer. Option C: basal cell carcinoma. Option D: brain cancer. The correct answer is option A: renal cancer. Correct answer A: renal cancer. Question 121. You will be reinforcing teaching and instructing the patient. Which basic principle of teaching should you follow? Here are the options. Option A: sequence the instruction from the least complex to the most complex. Option B: assume that the patient knows little or nothing about the topic. Option C: tell the patient to call their significant other so you can instruct them. Option D: use medically oriented terms so the patient will be able to speak with the doctor. The correct answer is option A: sequence the instruction from the least complex to the most complex. Correct answer A: sequence the instruction from the least complex to the most complex. Question 122. As you're administering penicillin intravenously, you determine that the patient becomes hypotensive and with a bounding, rapid pulse rate. What is the first thing that you would do? Here are the options. Option A: decrease the rate of the intravenous medication flow. Option B: increase the rate of the intravenous medication flow. Option C: call the doctor. Option D: stop the intravenous flow. The correct answer is option D: stop the intravenous flow. Correct answer D: stop the intravenous flow. Question 123. Your patient has a blood potassium level of 9.2 mg/L. What intervention should you anticipate for this patient? Here are the options. Option A: intravenous potassium supplementation. Option B: intravenous calcium supplementation. Option C: kidney dialysis. Option D: parenteral nutrition. The correct answer is option C: kidney dialysis. Correct answer C: kidney dialysis. Question 124. Which of the following foods enhances the absorption of an iron supplement? Here are the options. Option A: orange juice. Option B: green beans. Option C: fortified milk. Option D: baked potato. The correct answer is option A, orange juice. Correct answer A, orange juice. Question 125. Select a myth or falsehood relating to pain, pain management, and addiction. Here are the options. Option A, addiction can be accurately predicted. Option B, withdrawal, drug tolerance, and physical dependence do not indicate addiction. Option C, pain medications can be used with patients who have a substance abuse history. Option D, addiction is signaled when the client employs deception and stockpiling. The correct answer is option B. Withdrawal, drug tolerance, and physical dependence do not indicate addiction. Correct answer B. Withdrawal, drug tolerance, and physical dependence do not indicate addiction. Question 126. What is the expected date of delivery for the woman who has had their last menstrual period on April 20th? Here are the options. Option A, January 20th. Option B, January 27th. Option C, January 29th. Option D, January 31st. The correct answer is option B, January 27th. Correct answer B, January 27th. Question 127. Clumsiness, difficulty running, climbing, and riding a bicycle are some of the earliest signs and symptoms of. Here are the options. Option A, Duchenne's muscular dystrophy. Option B, osteomyelitis. Option C, Talipes or clubfoot. Option D, septic joint, suppurative arthritis. The correct answer is option A, Duchenne's muscular dystrophy. Correct answer A, Duchenne's muscular dystrophy. Question 128. Which statement about adjuvant medications is true and accurate? Here are the options. Option A, licensed practical nurses cannot administer adjuvant medications. Option B, adjuvant medications are Schedule II narcotics. Option C, adjuvant medications are Schedule I narcotics. Option D, adjuvant medications can be purchased over the counter. The correct answer is option D. Adjuvant medications can be purchased over the counter. Correct answer D. Adjuvant medications can be purchased over the counter. Question 129. Which non-pharmacological technique entails the use of electronic monitoring equipment while the patient controls basic bodily mechanisms? Here are the options. Option A, meditation. Option B, visualization. Option C, biofeedback. Option D, chiropractic. The correct answer is option C, biofeedback. Correct answer C, biofeedback. Question 130. Which of the following is considered normal for the neonate? Here are the options. Option A, chest circumference, 10 to 13 inches. Option B, length, 16 to 22 inches. Option C, weight, 1,500 to 4,000 g. Option D, head circumference, 12.6 to 14.5 inches. The correct answer is option D, head circumference, 12.6 to 14.5 inches. Correct answer D, head circumference, 12.6 to 14.5 inches. Question 131. Your patient has been diagnosed with giant cell arteritis. What medication will this patient most likely be given? Here are the options. Option A. High doses of aspirin. Option B. High doses of prednisone. Option C. Methotrexate. Option D. Albuterol. The correct answer is option B. High doses of prednisone. Correct answer B. High doses of prednisone. Question 132. The wound irrigation process cleanses the wound and here are the options. Option A. Reduces the potential of pain in the wound region or area. Option B. Stops the spread of infection by way of magnifying the clean area. Option C. Pushes extravasated blood from a hematoma into nearby healthy tissue. Option D. Allows for the introduction of medications in solution form. The correct answer is option D. Allows for the introduction of medications in solution form. Correct answer D. Allows for the introduction of medications in solution form. Question 133. You are caring for a 4-year-old female patient who was severely burned in a house fire. How would you determine the extent of this child's burns? Here are the options. Option A. By using the Lund and Browder chart. Option B. By using the rule of nines. Option C. By using the rule of tens. Option D. By using the Parkland formula. The correct answer is option A. By using the Lund and Browder chart. Correct answer A. By using the Lund and Browder chart. Question 134. Your client has a doctor's order that reads advanced diet as tolerated. This client has returned from the recovery room after an appendectomy, and he states, I am hungry. What would you offer this client to consume? Here are the options. Option A. Cheese and crackers. Option B. Applesauce. Option C. Chicken broth. Option D. A peanut butter sandwich. The correct answer is option C. Chicken broth. Correct answer C. Chicken broth. Question 135. Idiopathic thrombocytopenia purpura is. Here are the options. Option A. Highly similar to disseminated intravascular coagulation DIC. Option B. Caused by the overproduction of platelets. Option C. A bleeding disorder that is characterized with too few platelets. Option D. Treated with immune system boosting medications. The correct answer is option C. A bleeding disorder that is characterized with too few platelets. Correct answer C. A bleeding disorder that is characterized with too few platelets. Question 136. Select the type of skeletal fracture that is correctly paired with its description. Here are the options. Option A. A complete fracture. The fractured bone penetrates through the skin to the skin surface. Option B. A pathological fracture. A fracture that results from some physical trauma. Option C. A greenstick fracture. This bends but does not fracture the bone. Option D. An avulsion fracture. A fracture that pulls a part of the bone from the tendon or ligament. The correct answer is option D. An avulsion fracture. A fracture that pulls a part of the bone from the tendon or ligament. Correct answer D. An avulsion fracture, a fracture that pulls a part of the bone from the tendon or ligament. Question 137. Select the criteria that is accurately paired with its indication of birth weight or gestational age. Here are the options. Option A. Low birth weight. The neonate's weight is less than 1,500 g at the time of delivery. Option B. Appropriate for gestational age. The neonate's weight ranges from the 10th to the 90th percentile. Option C. Large for gestational age. The neonate's weight is above the 99th percentile. Option D. Small for gestational age. The neonate's weight is below the 20th percentile. The correct answer is option B. Appropriate for gestational age. The neonate's weight ranges from the 10th to the 90th percentile. Correct answer, B. Appropriate for gestational age. The neonate's weight ranges from the 10th to the 90th percentile. Question 138. Diabetes insipidus is the result of. Here are the options. Option A. A diet high in sugar and carbohydrates. Option B. A complicated pregnancy. Option C. A disorder of the pancreas. Option D. A disorder of the pituitary gland. The correct answer is option D. A disorder of the pituitary gland. Correct answer, D. A disorder of the pituitary gland. Question 139. Which position will you place your patient in when they are demonstrating the signs and symptoms of hypovolemic shock? Here are the options. Option A. The Trendelenburg position. Option B. The supine position. Option C. The left lateral position. Option D. The right lateral position. The correct answer is option A. The Trendelenburg position. Correct answer, A. The Trendelenburg position. Question 140. The fine, down-like hairs on the newborn's ears, shoulders, lower back, and or forehead are known as. Here are the options. Option A. Vernix. Option B. Lanugo. Option C. Milia. Option D. Vibrissae. The correct answer is option B. Lanugo. Correct answer, B. Lanugo. Question 141. What is the softening and thinning of the cervix during labor known as? Here are the options. Option A. Dilation. Option B. Symphysis. Option C. Effacement. Option D. Hyperplasia. The correct answer is option C. Effacement. Correct answer, C. Effacement. Question 142. Which of the following joints normally has 360-degree circumflexion? Here are the options. Option A. The knee. Option B. The shoulder. Option C. The elbow. Option D. The fingertips. The correct answer is option B. The shoulder. Correct answer, B. The shoulder. Question 143. Which healthcare-associated infection is the greatest risk for patients? Here are the options. Option A. Pneumonia. Option B. Catheter-related infections. Option C. Intravenous line infections. The correct answer is option B. Catheter-related infections. Correct answer, B. Catheter-related infections. Question 144. Select the nursing theorist who is accurately paired with the theory or model of nursing that they are credited with. Here are the options. Option A. The 12 Nursing Problems, Feiglin Abdullah. Option B. The Nature of Nursing, Imogen King. Option C. The Goal Attainment Theory, Virginia Henderson. Option D. The Interpersonal Relations Model, Hildegard Peplau. The correct answer is option D. The Interpersonal Relations Model, Hildegard Peplau. Correct answer D. The Interpersonal Relations Model, Hildegard Peplau. Question 145. Which technique or method is used to determine whether or not the patient has an irregular pulse? Here are the options. Option A. Apical pulse. Option B. Inspection. Option C. Auscultation. Option D. Percussion. The correct answer is option C. Auscultation. Correct answer C. Auscultation. Question 146. Select the tactile sensation that is accurately paired with its description or procedure for testing. Here are the options. Option A. Fine motor coordination, the use of the fingers. Option B. Stereognosis, equal hearing in both ears. Option C. 2-point discrimination, the nurse gently pricks the patient's skin. Option D. Gross motor function, the use of the lower limbs. The correct answer is option C. 2-point discrimination, the nurse gently pricks the patient's skin. Correct answer C. 2-point discrimination, the nurse gently pricks the patient's skin. Question 147. Which is considered an internal disaster? Here are the options. Option A. A patient fall. Option B. The massive spread of pneumonia. Option C. A computer hacking episode. Option D. Unexpected staff absences due to illness. The correct answer is option C. A computer hacking episode. Correct answer C. A computer hacking episode. Question 148. Who is credited with the stages of cognitive development? Here are the options. Option A. Erickson. Option B. Higgett. Option C. Freud. Option D. Lister. The correct answer is option B. Higgett. Correct answer B. Higgett. Question 149. You are working on a pediatric unit. Which toy or other diversional item or activity is most appropriate for your 18-month-old patient? Here are the options. Option A. A storybook. Option B. A beach ball. Option C. An interactive play session with other children less than 2 years of age. Option D. Pick up sticks. The correct answer is option B. A beach ball. Correct answer B. A beach ball. Question 150. You are caring for a patient who has no cognitive functioning but only basic human functions such opening the eyes and the sleep-wake cycle. What level of consciousness does this patient have? Here are the options. Option A. Abtunded. Option B. A persistent vegetative state. Option C. Locked-in syndrome. Option D. Brain death. The correct answer is option B. A persistent vegetative state. Correct answer B. A persistent vegetative state.